Hi everyone, I'm Dr. Jyotsna. I will be telling you about peak inspiratory pressure and plateau pressure, how to measure it, what affects it, and what are its relevance. Peak inspiratory pressure is the highest pressure during inspiration, and the plateau pressure is the pressure measured as a plateau on the pressure time scaler after inspiratory hold maneuver. What happens when there is an end inspiratory hold, there is no gas going in, and the exhalation valve has not been opened, so the no gas is going out. So whatever air is inside the lungs and the airway, it is going down further and getting dissipated in the lungs alveoli according to the lungs and chest wall compliance. So basically this plateau pressure is basically the pressure generated according to the lungs compliance. So how it is measured? In volume control mode, you have to simply press the inspiratory hold button for 0.5 to 1 second, or you can add an inspiratory pause for each breath. In pressure control, the pressure P plus pressure control is the plateau pressure or peak airway pressure. Because basically, in pressure control, throughout the cycle, the pressure remains constant, and it changes. The ventilator change it according to the patient's lungs compliance. So what affects it? Basically, if only peak inspiratory pressure is increased, like in this, like here, only peak inspiratory pressure is increased. The problem is either with the airway resistance or flow. Generally, flow is kept constant, so the airway resistance according to the patient's lungs, that is the cause of the increased peak inspiratory pressure if the plateau pressure is normal. If plateau pressure is increased along with the peak inspiratory pressure, the problem is with the lungs compliance. So, what is its relevance? Relevance is the main, basically the patient with ARDS ventilation. We have to keep the plateau pressure less than 30. So for the lungs protective ventilation. In COPD patient, to avoid dynamic hyperinflation, we have to keep it below 25 centimeter of water. If it suddenly increases in mechanical ventilation related patient, you can think of pneumothorax. It can be increased due to any reason which decreases the lungs compliance. Peak inspiratory pressure should always be correlated with the plateau pressure. If only peak inspiratory pressure is increased, it is either because of the airway resistance or because of airflow increase in airflow. If we keep generally we keep airflow constant, so it must be because of the some airway resistance, the mucus plus or bronchospasm, or from externally something is compressing the airway. And what is its relevance clinical? One of the thing is that we can understand ki, okay, there is some airway resistance. Another thing is that in the beginning of the bronchial asthma exacerbation or a COPD, when we have immediately have intubated the patient because of the acute respiratory distress, that time we will not able to ventilate the patient if the patient is on volume control mode and we have not increased the limit of peak inspiratory pressure. Thank you.